I think the biggest part of value-based care that is directed towards patients is really gathering all of the information on the patient that centers around their needs. So patient-centered care has been very beneficial for them and us. And I think in medicine as a whole, or in nursing as a whole, we often focus on disease states, how to treat those disease states, instead of looking at the whole patient. And so if we can look at our patients through that value-based lens, it helps us with continuity of care. We have the same practices in place for all of our patients, not just value contract patients, but all the patients that we see in our ambulatory practices in particular. So it's really helped us to center that care on patients, but also have some consistency throughout our patient panel.
Practicing value-based care for the patients that I serve, I've only ever worked with rural patients, so I see a lot more of the challenges that people have that don't really get talked about in media or a lot of the coverage. So really focusing on the social determinants. That's the people that can't read, the people that don't have access to the same things that other people have access to just because of where they live. Food deserts, and there were people that work in healthcare that don't even know what food deserts are, and that's something that I've worked with for years now, is trying to help people get connected with resources. So in value-based care, that's really a primary focus that we work to fix, is getting people to the right people at the right time to get what they need out of healthcare. Not just getting well from an illness at that time, but trying to focus more on a health-oriented perspective when you talk about health.
We have found that by practicing value-based care, it promotes wellness in our patients that we serve, as well as assists us in early identification of any possible diseases or problems that the patient may be having. It also allows us to focus more on patient-centered care. We help our patients learn how to manage their disease stages so that when they are able to manage them, it promotes better patient outcomes. It decreases the cost of care, and it also decreases the amount of visits to the ED and hospitalization the patient has to have, giving them a better quality of life.
Not only our patients are supported with value-based care, with the value-based care models, but I believe that providers like myself, value-based care helps us in our day-to-day work. It helps streamline our scheduling. It helps us to address our patients' preventative health care measures and close care gaps. It also helps us be more aware of diagnosing our patients to the highest specificity to let CMS know how sick our patients are. It also helps our providers treat patient for wellness instead of treating illness. And as a result, we get better healthcare outcomes for our patient, and it helps with our day-to-day work as we care for our patients.